For the preoperative assessment, identify the patients using at least two identifiers, usually name and date of birth. You perform your hand hygiene and repair equipment and room for assessment. Determine if the patient has any communication impairment like deafness, blindness, unable to read or understand English, and make a suitable compensation for that. Assess patient's understanding of the intent of surgery and anesthesia, and ask the patient to offer a description rather than asking simple yes or no questions. Ask the patient if they have a advanced directive and collect a nursing history and identify surgical risk factors like the condition requiring the surgery, chronic illnesses and associated risks like hypertension, bleeding risks, stroke, hernias, aspirations, if they have diabetes, any allergies. Determine if the patient has obstructive sleep apnea. Uh, Ask the last menstrual period for female patients and childbearing years, any previous hospitalizations, their full medication history, including prescriptions and over-the-counters, herbal recipes, remedies, and dates and times of last doses. Their previous experiences with surgery and anesthesia, their family history of complications from surgery or anesthesia, any allergies to food, tape, medications, especially about natural rubber latex, and then any physical impairments like paralysis or reduced range of motions of any of the limbs, any prostheses, implants, if they smoke, use alcohol, or any drug use, and the patient's weight, height, and vital signs, and their occupation to see how the operation will kind of affect their work life. Assess the patient's respiratory status, include auscultation of the lungs, character and rate of respirations, their O2 levels, the ability to breathe lying flat, the use of O2 or a CPAP at home, and any chest x-rays if you have that. You auscultate for heart sounds, evaluate the patient's circulatory status, including the apical pulse, ECG reports, and peripheral pulses, as well as the circulation, capillary refill, the temp of their hands. Assess the patient for risk for post-operative thrombitis, like a history of blood clots, the use of birth control pills, hormones. Ask the patient about any leg pain, observe for the calves for any swelling, warmth, or redness. Observe them both for symmetry and pedal pulses. After you complete a complete gastrointestinal assessment where you listen to all four quadrants of the abdomen, you palpate, you inspect for distension, you complete a neurological assessment, you ask the patient for their name, date of birth, where they are, what time it is. You assess their perla, make sure their eyes are equal and round, they're reactive to light. They accommodate when you ask them to look at a point at the wall and then at their finger moving in. You assess their neurological defects, if they have any numbness, tingling, if they don't feel at all, any sensations, the level of consciousness, and their cognitive function. Then you go to the musculoskeletal, which is including the range of motions of the joints. You examine the patient's skin, make sure there's any breaks or skin integrities, and determine the level of hydration, like their skin turgor. Assess the patient's emotional status, like their anxiety, their coping ability, if there's any family support here or if they need any potential abuse from a partner or family member, and review laboratory tests, including blood count, electrolyte, urinalysis. After that, you start going to the pre-operative teaching. You perform hand hygiene, put some gloves on. You inform the patient of the date, time, the location of the surgery, the anticipated length of the surgery, any additional time in post anesthesia recovery area, and where to wait for the family members. You answer any questions the patient or family have to the best of your ability. You instruct the patient about preoperative bowel or skin preparations as needed. You check the pre-med orders for the policy of your job. Instruct the patients about the extent of purpose of food and fluid restrictions for a period before the surgery. They should already be doing this before they're coming into the surgery room or the pre-op room. You're going to strive that preoperative routines like the timeouts, like site markings, IV therapy, if they need a urinary catheterization, the clipping or removal of hair, the transport to the OR. You're going to describe the planned effects of the medications they're going to get, and you're going to review the medications the patient needs to discontinue before surgery, and make sure if they haven't stopped it, you have to notify the MD, because that can cause some problems. They're going to describe what they're going to be feeling, like the blood pressure, cuff going on and off, the EKG leads, the cool room, the beeping of the monitor, because under sedation, these all could be kind of scary for them. Describe pain control methods after surgery. Describe what the patient is going to feel after surgery, like whether they're being awakening, their frequent bowel signs they're going to be doing on them, any drainage or tubes, or any compression devices they'll be having. Instruct the patient on turning and sitting up, especially those that's going to have abdominal surgeries or thoracic surgeries. You're going to teach them coughing and deep breathing. You're going to teach them how to use the incentive spirometer, the PEP therapy or huff coughing. For coughing and deep breathing, have the patient high Fowlers with bed and with the knees flexed. Have the patient sit on the side of bed or a chair. Instruct the patient to place their palms across one another and lightly lower bore the rib cage, and have the patient take deep, slow breaths, inhaling through their nose. Explain that the patient is going to feel a downward movement in diaphragm during inspiration or breathing in. Have the patient avoid using the chest or shoulder muscles while inhaling. Have the patient take slow, deep breaths, hold for like 3 seconds, and then exhale slowly through your mouth, as like you're blowing through a candle, blowing out a candle, like pursed lips. Have them repeat the exercise 3 to 5 times. Have the patient take 2 slow, deep breaths, inhaling through your nose and exhaling through pursed lips. Caution the patient against clearing their throat, because it doesn't really remove, clearing the throat doesn't remove mucus from the deeper airways. Practice deep breathing every 2 hours. You're going to teach them how to use an incentive spirometer. You explain how the patient puts their mouth on the incentive spirometer so their lips completely cover the mouthpiece. Instruct the patient to exhale completely, then position the mouthpiece so the lips completely cover it, and inhale slowly, maintaining a constant flow until the little floating lever reaches the goal intended. Have the patient hold breath for 2 to 3 seconds when they get to that goal, or as high as they can, and instruct the patient to breathe normally for a period of time between each of the 10 breaths taken on incentive spirometer. For the huff coughing, instruct the patient to get into semi-Fowlers or high Fowlers position, and place a nose clip over the patient's nose. Have the patient place lips around the mouthpiece, and instruct the patient to take a full breath and exhale 2 to 3 times longer than inhaling. For the controlled cough, explain the importance of maintaining an upright position, Demonstrate coughing. Take 2 slow deep breaths, inhaling through nose and exhaling through pursed lips or mouth. Inhale deeply on the third time, hold breath, and cough fully 2 to 3 times consecutively without inhaling between coughs. If surgical incision is either thoracic or abdominal, teach the patient to place like either hands or a pillow over the incision area. The patient continues to practice the coughing maybe 2 to 3 times every 2 hours while awake. For leg exercises, this will help prevent blood clots in the legs. Instruct the patient in leg exercises performed every 1 to 2 hours while awake. Ankle rotation, dorsiflexion, plantar flexion, leg extensions and flexions, and straining legs. Usually position them in the supine position.